Hi, everyone. Welcome to a new Sensibility edition. I'm delighted to have Deborah Bowes with us today. We are going to be talking about the concept of self-love. The reason I reached out to Deborah is because I think she has done some really great work in terms of self-care and using the Feldon Christ method kind of as a way to increase or improve your own self-care. So it seemed like a great sort of like doorway into the concept of self-love. But we're also hopefully going to discuss a little bit about the Feldon Christ approach to self-love, or why the Feldon Christ method may be a useful tool in developing self-love. So that's kind of where I want to go with this today. Deborah herself, she did her training in 1987, and she qualified as a trainer of the Feldenkrais method in 1999. So she's very experienced. She has a lot of years working with people individually and also training individuals. So I'm hoping we can tap into that resource during this. Deborah, I don't know if you want to kind of give a little bit more of an introduction before we start.
Thank you, Joe. So probably I should say, my initial training was as a physical therapist. Actually, my first degree was in physical education and biology, because I was, even at that point, very interested in how to get kids to feel comfortable moving and happy in movement. Instead of doing competitive sports, how can we do movement that allows a child to feel creative and successful? So my specialty was creative movement at that time. So then I really wanted to find a way to work and get out of my hometown in Rhode Island. And there were no jobs at that time in teaching anywhere else, or certainly not for a creative movement teacher. So then I went to physical therapy school, got my physical therapy degree, and then eventually found my way to San Francisco, where I got introduced to a whole new world. And I was pretty unhappy with physical therapy by that point.
Mhm.
I remember saying to myself, if I have to teach one more person how to get on and off a toilet, I think I'm just going to kill myself. It's just like not what I wanted to do. Although
Yeah,
it's really important, of course.
sure. Yeah.
Now I do all that pelvic floor work. But yeah, so then my friend Iris Urbasic, who's a German practitioner, and she was once president of the German Guild, she's lovely. She called me up one day and said she was going to do the training. And I thought, I want to do something with her and I want to be kind of part of that. And I said, I will too. And then I found that my physical therapy training in the training, the Feldenkrais training, was actually a kind of limitation, because I wanted to know how that happened, or, would you do that with this? I had asked all the same usual PT questions privately, because in my training, questions were not really accepted very well. So I didn't really asked one question once. I remember my heart was racing. I was so anxious. And then after that, I wanted to really practice Feldenkrais method. So I knew the only way I could do that was to open a practice.
Mhm.
So I found a space, a beautiful space that was on ground level, wheelchair accessible, natural light. And I looked for practitioners who might need a space. And Julie Casson-Rubin, who also lives in San Francisco, we have
Yeah.
children the same age. And I thought, boy, I bet she'd like to get out of her house and work. So I called her up. We didn't know each other. We met, and then we started working together. And we had the Feldenkrais. First, we called it the Center for Movement Education, because in those days, 1988, nobody used the word Feldenkrais in front of their work. How
Yeah.
dare we, right? So then after many years, we changed it to Feldenkrais Center for Movement and Awareness. And that happened also when my husband came from Australia, a Feldenkrais practitioner, Cliff Smythe.
Mhm.
So yeah, I guess that's, oh, and because of my degree, my license, my physical therapy license, I've had the opportunity to work in more kind of mainstream settings.
Mhm.
So I would often get invited to work or to design a program for chronic pain, say, or for injured workers. Or my most recent job that I left about 5 years ago was at Stanford University in a clinic for people with chronic complex medical conditions, which I love the complexity. And, people would hire me because I would say things like, oh, I love working with people with chronic pain, or I like seeing people who had a stroke like 8, 10 years ago. No, PTs don't really say that usually.
Yeah.
But with Feldon Christ, you have the tools, you have the knowledge and the skills to work with people in all kinds of ways. So that's and then COVID came, right? And so then I closed the practice and then just doing training, teaching. And then I was lucky enough to connect with Tiffany Sankari at movementandcreativity.com. And she's been wonderful support for me, sponsoring courses and really helping me develop an online teaching presence. So that's kind of it.
And that's how I became aware of you through her stuff. So I appreciate the work that she's done as well. Just
Yeah,
going
she
back,
is lovely to work with. I just want to
yeah,
say that.
yeah.
Yeah.
Just going back to what you said about you actually liking to work with those more complex or more chronic pain patients. I wondered if you could maybe sort of say why you like to work with them. Like,
Yeah,
I wonder if that
because
ties
I
in.
love to talk about that. You have to just shut me up after a while. But so with people with chronic pain, right? You're not just working with the person's movement. It's the
Mhm.
whole identity. It's how they think, it's how they sense themselves, it's how they feel. And I love that people with chronic pain are often at this questioning themselves, like, what is the meaning of this, right? Why is this happening to me? And there's a lot of emotional distress, changes in one's life, and awareness through movement, functional integration, just really helps give people the tools. Like, I had a lot of people with chronic pain, and when I started studying it, I would ask my clients, so why do you come to me? And I really expected people to say, oh, Feldon Christ is just fantastic. It's instead they would say things like, well, I really just like how you listen to me, how you work with me. I feel seen and heard as a whole person. So that was pretty interesting. And then with complex medical conditions, where someone has, say, diabetes, they poor diet, heart attack, chronic pain, high blood pressure, taking a bunch of meds, working in a stressful environment, that brings up the same kinds of issues of your identity. Why are you doing things in such a way that you can feel it's not good for you, right? And
Yeah.
how do you help people achieve success in little small steps?
Okay.
So
So, I mean, if
noticing if
we,
breathing. Go ahead.
yeah, I mean, if we consider that self-love as a concept is connected with identity, right? In some way that there's like a very direct connection between those two concepts.
Right.
I mean, it sounds to me like you're kind of making the case that Feldenkrais has a very direct impact on someone's identity in a way that it is broader than just helping them with their movement. And I wondered if you could maybe describe a little bit about like the why of that or the how.
Yeah.
Either.
So I think, yeah, that's a really interesting question, Joe. So one thing that I have experienced working with people with chronic pain is the importance of touching someone within the first meeting. And as I touch them, they most of the time people have been used to being like handled, manipulated by somebody. But I think the way that I touch it activates their brain and they're like, whoa, there's a whole different kind of way of being in the world. So that's
Mm,
one aspect. The other thing is during FI, I'm very attentive. Like if somebody flinches or looks funny or makes a gesture, I always ask them, well, what just happened? And if they say, oh, that hurt a little bit, then I say, oh, I'm really sorry. I mean, I think they feel the love, and I'm not talking romantic love, of course, but the love of another person. Like
mm,
sometimes, you get a client and you think like, oh, I don't know how to relate to this person. There's something about them that I just can't find relatable or even likable. And at
Mm,
that point, I would say to myself, open your compassion gates. And as soon as I would like feel like, oh, that person is similar to me, they want to be happy, they want to be loved, they want to feel good in their body, they want to feel good in their mind, then I could have this strong well of compassion towards someone
mm,
in a very kind of non-religious way, and be with them, and then teach people the principles of the method. Like,
mm,
don't teach them how to move their shoulder, but teach people how to pay attention to themselves,
yeah.
starting with the breath. That's always where I would begin. I don't know if I answered your question, but
I mean, I can follow it up with another one just based on what you
yeah,
said.
sure.
Do you
Hmm.
think, I mean, you mentioned compassion there, and kind of opening yourself up to the person that you're working with. Do you think that that's a specific you, Deborah thing, or do you think that that's something that's common across the Feldenkrais method? And if it is common across the Feldenkrais method, what is it about the Feldenkrais method that engenders a someone to relate to someone else in that way? You know?
Yeah, wow. Well, Moshe says that we touch people the way a mother touches a child, a good
Mhm.
mother. Have right? So that, I mean, most people have never felt as an adult or or older person that kind of being held by someone. Like, I often have the image, like when I'm getting FI, like I'm in the lap of the
Mhm.
person, just being supported, which was
Mhm.
very challenging for me at first. Like, I didn't want anyone to be that close to me. I found
Mhm.
quite uncomfortable. I would really dissociate, and I feel like I'm flying around the room and not in my body anymore. But then I learned to trust that.
Mhm.
And then I learned, like, how can I convey that level of trust? Because all you have to do is hurt somebody once or say something negative once. And if they are coming to you with an injury history or a trauma history, that's all it takes to trigger that whole thing starting again. So I
Yeah.
had to become very careful. And I think good practitioners do that.
Mhm.
And maybe they don't use the same kind of language, but it's right there basic in Moshe's writings, like
Mhm.
how to touch somebody. And when you watch his lessons that he gave in Amherst, in most of them, he has that beautiful rapport, right? It's the rapport. Like, you've probably had this experience, you meet one of your clients out on the street and it's like, this is my Feldenkrais practitioner, right? It's really close. Like, somehow
Mhm.
get into them. They feel you feeling them.
Mhm.
And that helps them accept themselves. Like, I remember people would say to me something like, so what do you think? And I would always say something like, I think you have a very intelligent nervous system,
Mhm.
because they're expecting some kind of negative judgment, which is what they got. I mean, because I tend to work with people who have more medical diagnoses attached to them.
Mhm.
And they've seen a lot of different people and they've gotten very negative. Oh, my back is all messed up, or, my shoulders are like an 80-year-old woman, or, oh, no, I can't do that. I can't kneel down because they told me, or I'm not supposed to lie on my belly. All this negative, negative, negative. Instead, I choose to be more permissive and
Mhm.
finding out, how can you do the things you want to do and still be really nice to yourself and not hurt yourself. I mean, I
Yeah.
hurt myself plenty in ATM.
Sure. Yeah. But I mean, it's part, I mean, like the thing that makes me think is like there's a set of conditions that we respond very well to in terms of learning. And then there's a set of conditions that we shut down in terms of learning. So it's like under these conditions, if I've been criticized and,
Mm,
I've been treated badly or I treat myself badly, the potential for learning just shut down completely. It's like uh, there's no part of me that's kind of keen for new information at that point. I'm just like, I'd probably swear at that point, like, leave me alone. I don't want new
right.
information,
I don't
right?
want you.
Yeah.
Exactly. Exactly.
But
Yeah, it's
like,
so much. Yeah. exactly. I mean, it's so much like working with babies, right? Because I used to work a lot with babies too. Like people say, well, here, hold the baby. It's like, wait a minute, wait a minute. Does the baby want to be held by
Yeah.
me? We
Yeah.
got to go there first so you establish this bond and this
Mhm.
trust
Yeah.
and not force anybody. I mean, in FI, we don't force anybody to do anything, right?
Yeah.
So we
Mhm.
feel, where's the ease? Where does the arm want to go? Where does the head
Mhm.
or the neck want to go?
Yeah. So
Yeah.
to me, it sounds like you've made a very good case for the hands-on aspect of Feldenkrais, which is called functional integration, being a form of self-love that people can share with each other. You know, it's
Mm.
like the relationship that you have with yourself has allowed you to be able to interact with someone else and inform them that they could interact with themselves in a different way. Does that
Yeah, that's good.
summarize?
That's
Yeah.
yeah, 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 keep going.
So then my thought process is so that it makes sense that the one-to-one work that we do with patient clients, whatever term you want to use,
Right.
right? That I can understand that, but how does the awareness through movement, which is like the verbally taught class, how does that tie into this kind of concept of someone building relationship with themselves and developing self-love?
Yeah, that boy, that is a process. So that takes a highly skilled teacher. One, you really have to understand the movements of the lesson.
Mhm.
Two, I like to bring this attitude of permissiveness, like rest when you need to. And even going over to somebody and touching them lightly and saying, you can maybe make that smaller.
Mhm.
And if any, I see anyone kind of grab their neck or their hand or whatever it is, the body part that they've just felt pain in, I will give a direction about if you're touching yourself because it hurts someplace, maybe you could do a little less,
Mhm.
right? That level of permissiveness, I learned working in pain programs of telling people they could rest, they don't have to do it, like they can make a choice. And so then at the end of class, when we would talk, if someone said, oh, that really hurt, like don't let that comment pass by. That's a significant teaching point.
Mhm.
Oh, what really hurt? Well, how did you do it? When did you notice the hurt? Oh, so you noticed it all through the movement. So why did you continue? Right?
Mhm.
Helping people to see their habits of wanting to perform, wanting to be good, wanting to be the best,
Mhm.
um, and not accepting the position that they happen to be in. So I should say that I had a very severe accident a long time ago. In 92. Was it 92, I think? Yeah. And I had a head-on car crash. And
Okay.
I herniated all these discs in my neck and
Mhm.
I couldn't work for a year and a half. I was in so much pain. I was also getting divorced. I was
Mhm.
in an emotional wreck. I had no money. I had no car. Um, and I started going to lots of practitioners, Feldenkrais practitioners, osteopath, acupuncture, and I started doing Jungian psychotherapy.
Mhm.
My teacher, that this older woman I saw, Hildegard Ellsberg, and we did things that were kind of like it wasn't like psychodrama, but it was similar, it was like that kind of thing in a group. So I did a lot of different things. And what I discovered is that some people were very judgmental of me. And the
Mhm.
judgment was like, well, if you weren't so messed up, you wouldn't have so much pain. And I thought, exactly, that's true. So here I am. What are we going to do about that? And
Mhm.
the people who really helped me just accepted where I was at and just, no judgment. And I started to realize that Feldenkrais practitioners were some of the most judgmental people that I saw, judging. And I think because we are judging, right? We are judging, how does movement happen? Where is the forces going through? What is the relationship of the diagonals or the five lines or whatever? There's a judgment component of that. And it
Mhm.
easily slides over into judgment of the person.
Mhm.
And when it slips into judgment of the person, is like, whoa, you are not helping me. Also, at that time, I was already an assistant trainer, so I was kind of intimidating to people for some
Mhm.
crazy reason, but that's human nature too.
Mhm.
So that's when I started to look at this idea of removing all judgment to the person is doing the best that they can.
Mhm.
And in awareness through movement, we can teach them how to like do less. Even my Hildegard Ellsberg, she would say to me, Deborah, why are you doing so much? You know that it hurts you. And I thought, like, yeah, why? Because I
Mm.
wanted to be the best. I had that image that I could be the best and do it the most creatively. And boy, that was a real limitation. And
Yeah.
ATM taught me that. So I'll just share one other experience. I went to an ATM class at the time where the lesson was lying on your front. I don't know what it was, but you had to lie on your front. And at that time in my recovery, I could not lie on my front. I could only lie on my back with a certain pillow. So what happened as the teacher started teaching, I got so furious. I was like, they know I'm here. They know I can't do that. Why are they teaching this? Because what did I want? I wanted someone to like just take care of me. And that was a very important point because I thought like, I mean, I'm aware, of course, of that stuff. And I'm realizing, why is this bothering me? It's like, oh, because I want them to take care of me. Because why? Because I'm special, right? So at that point, I realized, oh, no, 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 you actually can take care of yourself. You can take care of yourself. And so
Mhm.
I did the whole lesson lying on my back and in imagination, and it was fantastic. And it was fantastic, not from the movement perspective, but from the insight that I got about my own feeling state that was just limiting me. And that's what I was kind of looking for with everything I did. I wanted that prince to come and rescue me. Or
Mhm.
princess, someone, and we can rescue ourselves. So that's why I'm so confident working with people with pain, because I kind of know what some of the
Yeah. Yeah.
traps are here.
Yeah. And you've seen people be able to learn how to start taking care of themselves.
Right.
That
Like,
like that's consistent.
right.
Yeah. Yeah.
You're right. Even my students will say, oh, I saw there was a new student in class. Yeah, I could tell they were new because they were just thrashing themselves about. And that
Exactly.
person
Yeah.
was the biggest thrasher when they first came.
Yeah.
So
Yeah.
they do learn like
Mm.
doing less, and but that's by bringing in a very skillful way principles that we know as practitioners in the method.
Yeah.
So sometimes it's not enough to say do less. It's enough to you have to give the reason why. Why do we do less?
Yeah.
How can you let your brain be more sensitive? How can you allow your nervous system to be more available for receptivity?
Yeah. So,
Yeah.
I mean, just to kind of like dig into that point a little bit about like doing less. So, one of the things you were talking about is judgmentalness, and our kind of desire to do something well, kind of leading us down a difficult path. And
Right.
as you were talking about it, one of the things that I thought was that the feeling behind that is that I'm not enough in the way that I'm able to do it. And in not being enough, then I feel like I need to try extra hard. And that's where the advice comes in to like do a bit less or to slow it down, so that the
Yeah,
person
right.
feels exactly what they're doing, and then it is enough, you know.
Right. And you can also reframe it in a way like you can
Yeah.
say, if you want to do a lot towards taking care of yourself.
Mhm.
If you want to be competitive in that sense of caring for yourself. Don't be competitive with your neighbor. Don't be competitive with yourself. So I try to offer people a way that if you want to strive to be strive to be more aware, strive to be taking care of yourself.
Yeah, I like that.
Yeah. The other thing is because people feel better usually after one ATM with a skillful teacher who chooses a lesson well, knows the lesson, knows how to make it permissive and adapting. That person's definitely going to feel better at the end
Mm.
of the lesson. The same thing with FI. People feel better after one session. That instills so much trust,
Yeah.
right? Like,
Mm.
oh, I
Yeah.
want more. It might not happen every time, but usually the first time people
Yeah.
feel better,
Yeah, and
which
I think that relates back to the one-to-one work. It's like when you're given an example that you can feel better by someone else, then you're
Mhm.
like, oh, I didn't even know I could feel better. Like,
Right, right.
you
Yeah,
know,
I start with find a comfortable position to lie in.
mm,
I remember one woman saying to me, I don't even know what comfort is.
yeah,
Oh, so let's start there. So take your
mm,
time, make the whole lesson about, using the right head support, the right
mm,
arm support, the right knee support, and continually asking, is that comfortable? And then you have to also tell them why that's so important,
mm,
right? You have to reassure, you have to calm the limbic system,
yeah,
reassure the nervous system.
yeah, and in some way, that's like giving them the context for developing their relationship with themselves.
That's right. That's right. Mhm.
Yeah,
I mean, even how people touch themselves, my husband and I, Cliff, we did a class called Self-Touch for Health or something like that for with Tiffany on movementandcreativity.com. And you know, wait, they just touch you and you feel like, oh my God. I used to work someplace where a woman would come over and stand next to me and put her hand on my shoulder and she'd be pushing me down and pushing me
mm,
down, right? And she'd say, why are you going down? It's like, well, because you're pushing me, right? How do you touch a baby? Or
mm,
dogs are great, dogs and cats, because if you touch a dog the wrong way, it gets up and moves
yeah,
or growls at you. You touch a human the wrong way, they're like, oh, well, it wasn't so bad. I can
yeah,
take it.
it's true.
Yeah.
But when you were talking about picking up a baby or whether a baby wants to be held, it's very much
Mhm.
the same with a cat as well. They will tell you if they're happy being held. If they're not, like forget
Right.
it.
That's
Don't
right.
even try.
Right. We have one cat, we'll let you hold her as long as you're standing up.
Yeah,
And
yeah,
especially if you walk as you're holding her, she's really happy. But as soon as you sit down, she's like, I'm out of here. I don't
yeah,
like this.
yeah. Okay, well, I feel like that's maybe a good point. I don't know if you wanted to do a little bit of work with self-touch.
Sure.
Yeah,
Hmm. Okay, we ready?
yeah,
Yeah, great. All right, so let's do something in sitting so you don't have to walk away or get mad or something like that. So I'm going to lower my chair a little bit here so I can have my feet on the floor better and then tilt my screen a bit. Okay. So find a way now to sit on your chair or your stool, and hopefully it's something firm. If it's super soft, it's not going to be so easy, but something firm, you can have padding or a pillow. I will show you what I use. I have this really nice gel pillow that I put on my hard chair because years of sitting on hard stools it's made me enjoy a little more padding. And that's the important thing, like be comfortable, right? So be comfortable and come forward so that you're not leaning back on your chair, but you can start to have the sense of support, skeletal support from your sit bones, the bones that you sit on in your pelvis, like little feet. The legs, the feet can be touching the floor and hopefully flat. And your arms, let your arms be comfortable, right? So maybe your hands rest on your thighs or they are in your lap. Or if you have arms on your chair, if you're more comfortable with your arms on the chair or a pillow under your arms. And now start to make a small movement of just looking down towards your belly button, right? Bending your head, looking down towards your belly button, and then looking forward again. So that's the movement. So just begin to make that movement very small. You might not see your belly button. You might see just between the thighs, which is also fine. And how are you breathing with that? When do you breathe out? When do you breathe in? So in some way, can you match your movement to your breath, either breathing out as you bend or breathing in, and then breathing in the other direction as you erect yourself. So continuing to notice your breathing. Now notice how the weight shifts on your pelvis, on the bones that you're sitting on. So the weight shifts a little bit backward towards the back of your pelvis, towards the tailbone as you look down. And then as you look forward, the weight can shift more forward. And one more place to notice is the pubic bone now. So as you shift backward and look down, think of your pubic bone coming away from the chair. And as you go forward, think of pressing the pubic bone towards the chair. And do it a few times that way now. Your breathing is coordinated with the movement. You lift the pubic bone and you press the pubic bone. Are there any places that you feel strain? And if there are, don't go there, right? See, what can you do maybe to round your whole back? Let your shoulders relax, let the neck relax. Okay. And then just come to where you feel supported. So one thing we do in Feldon Christ too is that we use movements to exaggerate certain parts moving. So one thing you can do here is if you bring your hands to your ears, so you're not covering your ears, but your ears are between the thumb and the fingers, and you can feel where your elbows are. And now start to bring your elbows down a little bit, adding to that movement, and then bringing your elbows up a little bit. Still with all the other things happening, you're breathing out as you go in one direction, breathing in another direction. The weight shifts on your sit bones, the pubic bone lifts from the table or the stool or the chair, and then goes pressing in. And at some point you might feel that your shoulders are really tired, so you can just take your hands down whenever that happens. Okay, so we'll go in a different direction now. So coming in, just feeling again the support through your spine, the sense of breathing. And place your hands now on your sternum. And here you can feel, how is it that you're touching yourself, right? Don't think of like compressing yourself, just thinking of making nice soft contact, like you, like you like this person that you're touching. And as you bend now and let the weight go back, think of the hands softly softening your chest. A soft chest really allows us to feel more of our complete emotional repertoire. So softening the chest, bending down, still the pubic bone going towards the chair, away from the chair. Okay, and then come to sitting. And a few times now with your hands, I'm going to back up so you can see, you're just going to move them on your thighs very comfortably down towards your knees. Right, so your hands move down towards the knees and then back. And as you reach towards the knees, allow your whole self to bend a little bit from the hips, very easy. And observe the quality of the touch of your hands, this softness, right? You just conform to the shape of your legs. And your hands feel the texture of your clothing and also the shape of your skin and muscles underneath. And then find a perfect place to rest your hands. And this is a lot of variation, right? So if maybe you like your hands more towards your knees or more towards the fold of your hip or somewhere in the middle. So how do you know what feels best? Is that you experiment. So try your hands in different places and see how it affects your breathing. So these sorts of experiments with touching parts of your body that can feel really nice, or finding out like, well, where do I habitually rest my hands? Some people will always put them on their knees, which maybe makes them lean forward a bit, or they have their hands back in the fold of the hip, which maybe makes them be in a different position, or somewhere in the middle. So just find for yourself where your hands can be resting. And then slowly scoot back if you have a back to your chair, to lean, to have some support of the back. Let your arms rest on the thighs in the spot that you found you could stay in for a long time. That's usually the most comfortable place. And now sense your breathing. And we can sense the breathing space in all the directions. So there's a forward movement of the breath, with the belly moving a little bit forward. Maybe even the breastbone moves a little forward. And now feel the sideways movements of your breath, that you can breathe into the ribs on the side. So it's like you get a little wider as you breathe in and a little narrower as you breathe out. And you can feel the ribs touching the soft belly parts of your arms. Letting the air just come in and out comfortably and easily through the nose. And now sense the movement backward with your breath. You might be able to feel the ribs moving back a little bit and touching the chair back a little more. Or if you're not leaning on a chair, you don't have that, you might be able to feel movement there. And then a few times as you're breathing, expand your awareness that you're breathing in all directions at the same time. So just like blowing up a balloon where the whole thing expands, your whole breathing space can expand and shrink as you exhale in all directions. And being able to sense your breath like that is a really great way to know if you're taking care of yourself with movement. So if you come back to the edge of your chair to end this now, just a little bit of flexion, and just feel how that is now, right? Can you do it with breathing the whole time, your hands softly resting, no pushing with your hands, adjusting the comfort of your hands as whenever you need to, and just flexing a little bit and coming up a little bit, the pelvis rocking backward, the pubic bone lifting and pressing. And then bring it to a close. And it's important to just notice, did this calm you at all, right? This certain state of self-care. Usually we're like, all sympathetically aroused during the day. But every day you need to learn what being more parasympathetically dominant it feels like, and doing it. So a simple thing like that with certain qualities of just bending and extending can really help you calm your nervous system, a calm mind, a calm body. And I think that's what we'll end with.
That's great. Thank you so much, Deborah. I really appreciate
Thank you,
your
Joe.
care and attention.